The term sustainable on its own just means able to continue for a long time. And so there are many different aspects to sustainable surgery that we can do to continue for a long time. However, to me, what's important is surgery that has a minimal impact on production of climate change gases, because it is the problems associated with climate change that are to me the most critical at the moment. But also, not only would the changes focusing on reducing those gases improve the future of our planet, but also I think the changes that you would make would benefit other forms of sustainable surgery. For example, surgery which provides social justice without forcing slave labour on people around the world to provide our instruments. Financially sustainable surgery, because we're using often more economically efficient methods. But also for the patients, often more sustainable, as in the patients have better outcomes. So I think, while to me sustainable surgery in as a term, it means surgery with a lower greenhouse gas output, it actually leads to an improvement in many types of sustainable surgery. I think the answer to that question is good and bad. Certainly the NHS has done a lot of work over the last 20 years to reduce its carbon footprint. However, it's been recognised that the actual steps that have been taken have been the easy wins, and to reduce it further is going to take a lot of concerted action between all staff members. Specifically, however, within surgery, I think we have a lot of progress to make. Surgery itself is a part of the NHS, which has a high footprint due to the amount of energy that's needed in theatres to power the lights, the anaesthetic machines, the energy devices that we use, as well as a high level of consumables that are used in theatres, and then of clinical waste afterwards that needs to go for high temperature incineration. So all these things together make surgery a high carbon part of the health system. How would you say surgical companies address this matter? So there's two types of surgical organisations that I think that are very relevant within improving the sustainability of surgery. So firstly, organisations such as the Royal College of Surgeons or even ESCP need to give very clear guidance to surgeons and all healthcare professionals involved in surgical patients on how to optimise patients to prevent the need for surgical care, but also to prevent complications in those who need it. For example, ensuring that all patients have their COVID vaccine. Vaccination is a low carbon treatment compared to somebody who then needs to be managed on an intensive care unit for months at a time with severe COVID illness. Also ensuring that your patients are physically active, stop smoking, moderate their alcohol, ensure they have a quality diet, and all these things can really make a difference, optimising a patient prior to surgery, but also reducing their need for surgery in the future. This must be part of our clinical practice, whether it's our history taking and our advice when working patients up for operations. But then there's also the industry type of surgical organisations like Medtronic or Ethicon, and I think what they really need to do is provide us high quality reusable instruments. At the moment, many of the instruments that we use in the surgical world are single use, and is no real reason that that is the case. It is driven by the industry to increase their profits. And I think it's time that needs to stop. We need to ensure that we have reusable instruments. For example, I've been able recently to change from using disposable laparoscopic ports to using hybrid ports, where the majority of the port is reusable, with just the working part, the top, disposable for each case. And these ports are of similar quality to the disposable ports. They all have their advantages and disadvantages, but I find no difference between using them. I've been lucky to find a company that supply these. However, what I'd really like to do is use reusable staplers. The staplers we use, they are reusable. They come with you can reuse them several times on the patient, but I don't understand why we have to throw the cartridge away at the end of the case when we've been able to reuse it several times on the patient. They need to design a stapler which is hard wearing enough that it can be re-sterilised, so that all we need to do is get disposable cartridges for each case. Sustainable surgery, which is focusing on prevention, can do much on improving the health of our patients. So if a patient, for example, who's coming for a gallstone operation, can be spoken to and really helped to change their lifestyle, to stop smoking and do regular daily exercise in the build-up to their surgery, then the chances are they may well continue with that if they realise the benefits that it's had on their life, and that can then have a massive impact on their lifetime. So being a surgeon is not just about doing an operation, it's about thinking about the whole patient and making sure that you improve the health of the patient and not just act as a technician performing the operation. I've already mentioned several steps, for example, using more reusable kit and focusing on prevention in your patients. But another really important step is to consider the anaesthetic. So it's really important to consider that anaesthetic gases in themselves are very potent climate change gases. So one molecule of one of the anaesthetics is equivalent to about 100 times a molecule of carbon dioxide. And there are various different potencies of the different gases. Some can be much worse than others, but even the best one still is much more potent than just one molecule of carbon dioxide. So it is essential that we avoid a general anaesthetic at all times. Encourage the use of intravenous anaesthetics when possible, because that doesn't have the same sort of problems on the gases, but there also are some techniques that are being put in place to catch the molecules of anaesthetic gases as they're breathed out, to prevent them from escaping into the atmosphere. But in all cases, if we can avoid an anaesthetic during our surgery, that would be beneficial. For example, and there are also benefits for the patients. So, for example, hernia repairs under local anaesthetic, it's been demonstrated that actually, although it's probably easier for the surgeon if the patient's knocked out, they don't have to worry about what they're saying during the operation, the outcome has shown that there's less pain. Certainly patients who've had their surgery under local anaesthetic leave the hospital quicker, but they need less pain relief after their operation, and for that reason, the recovery can be better. So inguinal hernias can be performed under local anaesthetic, as can small umbilical hernias, and then also considering spinal anaesthesia. So perianal conditions can be performed, and there's new methods of spinal anaesthesia that can be performed so that patients can have day case procedures quite quickly. So although it's not quite so dignified for the patient, if there's team working between the anaesthetist and the surgeon in the build-up to the operation, putting forward that these cases are best done under spinal anaesthetic, then it helps the patient to be involved in the process and accept that they can have these cases performed such way. So, for example, doing perianal fistula disease management and pilonidal treatment. So I think that's one of the steps to focus on.